What questions or problems are you working to solve?
So one of the problems that I'm working on solving is around the topic of patient safety. When we talk about patient safety, the question isn't just how do we prevent harm, but how do we prevent harm before it happens? This problem or challenge came to me recently as I was working with a team on improving their barcode medication administration compliance rates. This is a key safety practice to ensure that we are administering the correct medication to patients. However, these types of technologies are very susceptible to the actual user of the technology. So that would be our frontline nurses. So having a lower compliance rates is a signal that we may not be engaging in the safest practices. So as we reviewed the data and we met with the frontline nurses, what we quickly realized is that there were several underlying issues related to the programming of our EHR and the interface with the scanning that was relating to the unsafe practices. So this really was a system issue that was leading to these nurses having to manually administer the medications and having unsafe practices. So by addressing those underlying system issues, we quickly saw the practices improving, and then we saw it in the data. So over a 6-month period, the scanning rates went from 89.7% to over 95%. But more importantly, we reduced the opportunity for harm. So right now, one of the most pressing inefficiencies in healthcare is how we design our workflows to support real-time decision-making. And in many ways, our systems aren't quite agile enough to keep up with modern practices and workflows. And while automation and AI are offering tremendous potential, they're only tools. And the real question is, are we using them to streamline patient care, or are we complicating it further? This is what drives me every day. One key data point to consider is that every year, medical errors account for over 400,000 preventable deaths in the US. That's not just a number, these are lives that we've failed to protect. So to start solving this, we need to shift our thinking from reactive to proactive, to begin listening to our frontline staff, observing where the processes break down, and using data to empower care teams to make real-time decisions. We should be building systems that adapt to the complexities of healthcare and not the other way around.
Why have you chosen to pursue this question or problem?
Chosen this work because fundamentally healthcare should be about creating value for our patients, and that begins with safety. I believe that outcomes matter, but we can never achieve positive outcomes if we don't first ensure that we're not doing harm. It's the core part of our oath as healthcare providers. My passion comes from professional challenge of working with teams to reimagine how we deliver care. Not just about finding inefficiencies, but finding opportunities. It's a very different mindset. We have the tools, the data, and the talent. What we need is a commitment to rethinking how we use them to improve patient safety as well as outcomes. I have always stood by the motto, we need to work smarter, not harder. I think one of the things as leaders is that we think that we have all the answers related to how to work smarter. And really where the brain trust and the solutions lie is with our frontline staff. And so the more that we can engage them, gather data from those frontline staff, it makes it easier to come up with realistic, viable solutions, as well as to implement those solutions once we decide upon them.
As individuals and collectively as a society, what can we do to help answer the questions or solve these problems?
One thing I've learned is that solving these problems isn't something healthcare professionals can do alone. It requires us to involve patients, caregivers, and families as a part of a solution. Too often, we assume that what's best for them rather than asking them directly. We need to move toward a more collaborative model of care that incorporates their voices. And we're seeing a lot of trends related to patient-reported outcome measures, and these being incorporated with patient experience surveys and scores. So adding the voice of the patient to developing new ways to develop healthcare is really the next strategies that we need to start looking at and focusing on as we look to improve working with our teams. If we want to drive meaningful change, we need to push for systems that not only keep our patients safe, but also engage them in the process of staying safe. Every individual in healthcare, whether you're a provider, a policymaker, or a patient, has a role in advocating for safety first systems. The first action that we all can take is simple but powerful. Listen. Observe the gaps and workarounds and act swiftly on those insights. When we build systems with a focus on patient experience, we bring everyone along in the journey to safer care. At an organizational level, hospitals and healthcare providers need to prioritize continuous learning from safety trends, not just from individual events. It's about, again, making prevention a daily practice and not an occasional event review process. The action that we can take is twofold. First, create mechanisms that enable faster safety event reviews, like a QI team focused on trends. And second, involve everyone, patients, caregivers, staff, in building a culture of safety when transparency and speed are valued. We all play a role in ensuring that the system works for us and not against us.